here, and thank you everybody so much for joining. It's wonderful to see you. This is, gosh, I can't believe it's the last week of May. It's just crazy, but it's wonderful to have you all here. I'm delighted to let you all know that Senator Jill Carter is on as well. So we have two state senators joining us today. Thank you so much to both of you for being here, Senator Kagan and Senator Carter. Great to have you. Before we begin, we will be using the chat function. So if you have questions for any of our panelists that you did not have a chance to send in, or you just really want to highlight, make sure you use the chat function, which you should be able to find on the lower part of your screen to ask questions and whatnot. But thank you everybody so much for joining us this afternoon. I'm Delegate Brooke Learman, and I represent, along with my teammates, Senate President Bill Ferguson, Delegate Robin Lewis, and Delegate Luke Lippinger, the 46th District in Baltimore City, although of course I work at the state level to pass and implement policies that affect our entire state. Before we begin today, I just want to make a few points about where we are today and why I host these webinars with these exciting panelists. I'm just thrilled to have these amazing women on today. I really believe that being an elected official is about more than passing legislation, and I think probably both the senators who are on as well believe that as well. It's really about connecting people with the resources that they need, driving discussions about important topics, and advocating for change in multiple ways, and including through discussions like this one. Government is really about reducing barriers to success and creating opportunities for all while making sure we're keeping our residents safe. And as we find ourselves in the midst of this great public health crisis, with unemployment filings that have surpassed any previous in my lifetime, and people hurting, and us seeing, unfortunately, tragically losing many Marylanders, we know that we are in the same storm, but we are not all in the same boat. And we need to be mindful of that as we move forward so that we can make sure that we are lending a hand where needed. So today in Maryland, we have 47,687 confirmed cases of COVID-19. And we've lost nearly 2,200 Marylanders to the disease. We have over 1,300 in hospitals. And after a decline for a few days, we've now seen a slight increase in the hospitalization rate, which is concerning. Today, I thought, when we put on these briefings, my goal is to really be a resource to people during this challenging time and to bring you information that will help, to help make sure that our nonprofits, our philanthropy groups are included in that discussion. I know for my part, and I'm sure Senator Kagan and Senator Carter would say the same thing, it has never been more obvious how important a role our nonprofits and our philanthropy groups have to play than it has been today. Every week I am coordinating calls in Southeast Baltimore and South Baltimore and Brooklyn and Curtis Bay, all around my district, with the nonprofits that are working to bring resources, to fill the gaps, to meet the needs of the residents that they serve. And our philanthropic organizations have really stepped up to the plate to make sure that these nonprofits can continue, and to make sure that the philanthropic groups are working together to lower barriers to success for these nonprofit institutions. So I'm just really delighted today to have such a distinguished group to talk through the important role that our philanthropic organizations play in directing resources, in helping to think strategically about confronting problems, and in creating a more resilient Maryland and more resilient communities. So without further ado, love to introduce Heather. Heather Iliff is the president and CEO of Maryland Nonprofits. She's responsible for advancing the organization's vision to create a highly effective, ethical, and accountable nonprofit sector that drives change through collective action and advocacy. We're going to start with Heather, and then we're going to work through our panelists and then open it up for questions. So Heather, take it away.
Thank you so much, Brooke. It's really a pleasure to be with you today, and we so appreciate your leadership during this crisis. We've seen you really rolling up your sleeves and taking action and working shoulder to shoulder with leaders throughout your district and the state. So thank you so much for that.
Yes, thank you.
So Maryland Nonprofits is a statewide association of nonprofits. We have more than 1,000 nonprofit members, and keep in mind that there are more than 30,000 nonprofits in the state of Maryland. And about 8,000 of them are large enough to have staffs. Most nonprofits are small and all volunteer. So also just to keep that in mind, the profile of the nonprofit sector that employs 12.9% of Maryland's private sector workforce. So we really appreciate it when elected officials like you do convene settings to talk about the importance of philanthropy and the organizations that serve the community in good times and crisis times. So without a doubt, this crisis has stretched the philanthropic community and the nonprofit community further than anything we've ever seen. Obviously, we're all seeing something that is unprecedented in our communities, and some touchstones that I think are really important. First of all, that we should all understand that nonprofits primarily are businesses like other businesses. And most nonprofit revenue comes from fee-for-service for the programs and services that they provide in the community. And the second highest source of revenue is government. 32% of funding for nonprofits comes through various federal, state, and local government sources. And so philanthropy is incredibly important to the nonprofit sector, and depending on what kind of nonprofit you're in, you might be almost 100% funded by donations from individuals, foundations, and corporate donors. But overall, philanthropy accounts for about 12 to 13% of all nonprofit revenue. So keeping in mind that even within that 12 to 13%, foundations and corporations have an even smaller slice of that. So individuals still are the primary sources of philanthropy for nonprofit organizations. And so when we think about what the role of philanthropy is in supporting the sector in a crisis, we need to think about those resources in terms of leveraging more so than sustaining. So the philanthropic dollars can do things that state dollars cannot do, that government funding cannot do. And a lot of that is seed funding, innovative funding, funding that might be risky, funding to organizations on an unrestricted basis, supporting small community-based organizations, people of color-led organizations that may not have the very expensive audits in place, may not have all of the infrastructure that you would need to be able to be held accountable for government grants and contracts. So those are some of the important roles that philanthropy can play overall. And then going to a crisis time, we really think about the funding, of course, is very important to increase funding for all of the issues driven by the crisis itself. So the need for food, the need for laptops, the need for alternative shelter, laptops and internet connection for kids and families who are trying to participate in remote programs, and those kinds of things that come to mind first and foremost. And then also helping nonprofits even out through the gaps, like perhaps they can speed up grants, getting them out sooner. They might be able to increase their payout rate in a crisis so that they can keep their current grantees in place, as well as funding additional organizations. So I'm sorry, Brooke, and maybe you just wanted me to give a brief intro. Those are some of the things.
No, that was great. No, that was excellent. Thank you. I think that's really helpful, and it sets the stage, because you're right. You know, a lot of the government funding that's coming out right now is very strings attached and very specific for very specific organizations. And certainly we have a number of organizations here in Baltimore that are going to be left behind and that are not eligible. And of course, I always like to remind people, so I'm glad you did too, that nonprofits are businesses, and they just are a different type than we normally think of, perhaps. They're not making widgets, they're making life better, right? So,
right.
So I appreciate you emphasizing that as well. Now I'm really excited to turn it over to Danielle. Danielle is the director of the Open Society Institute of Baltimore. She was just named that in January of this year. She's a proud Baltimore native, and Tourine brings a decade's experience in the public, nonprofit, and philanthropic sectors to the job. So I'm thrilled to have her here with me. You've had quite a christening into the philanthropic space, but thank you so much for joining us today.
Thanks for having me.
Forward to hearing your thoughts on where we are and the important role that OSI is playing today in Baltimore.
Thanks, Brooke. So first, I just want to say thank you for having us. I'm in the company of my teammate here, Karen, and we're actually going to tag team a bit to share
Perfect.
a high-level overview of some of what OSI has been working on. Our intention in sharing this is to share like one of many examples of the type of movement that is happening in the philanthropic sector. And our hope is to contribute to the conversation, but also our hope is to illustrate or be reflective of some of what work also our other foundation colleagues are actually moving in this time. I want to lift up Celeste and Maryland Philanthropy Network at this time as well, because a lot of what we have been able to do as OSI is largely because of the spaces that have been convened by Maryland Philanthropy Network. And I just want to lift that up because that having that level of infrastructure, that capacity to quickly pivot and create spaces where foundations can come together, sometimes with public agency partners, to outside of the context of competition and territory, to really drop back and say, okay, what does Baltimore need and how do we all fit into a bigger picture? Is really, really important, especially when we're talking about times of response and crisis. And that has been a type of capacity that Maryland Philanthropy Network and the team there has been providing to all of us, and it has made a lot of partnerships and collaborations possible. In the way of background on OSI, as many of you guys know, OSI is the only U.S. field office of the Open Society Foundations. That means that we have our presence here in Baltimore, but we're also a part of a larger system and network of grant-making institutions that actually stretch across the globe. That's really important to note because as we have been organizing our response effort, we've been looking to leverage against other local resources. So the resources brought to bear by our private foundation counterparts, local agencies, but also we've been looking for any opportunity to exhaust resources through the OSF system as well, in partnership with our other national and global colleagues. And this is an important capacity to always keep in mind when we're talking about national foundations that are anchored here in Baltimore. Our response effort is about $1.25 million in total, but that has been leveraged against other contributions. That is a combination of dollars that we've repurposed. So we went through a process of looking at our existing portfolios to say, okay, what work is pivoting? What can we make available to Baltimore? Like, what are we hearing? What's trending? And then we also made some internal cases for an additional $1 million in support from our President's Reserve. So that's from our National Reserve as well. And also in support of that, we have the support of a global team, which is called the International Migration Initiative. So that's a global initiative that's focused on cities that came in to say, hey, we want to actually support what is happening in Baltimore. So we just wanted to lift that up in the way of collaboration. OSI's efforts include an initiative on direct cash assistance, delivering direct emergency assistance to individuals. We understand that right now, like we have a lot of folks who are struggling, even for small support. This is both workers who've been isolated from the workforce because of COVID. This is also in many cases grassroots advocates and leaders that we're hearing from that are coming out of pocket to support a lot of really critical humanitarian and aid efforts around the city, and themselves don't have places to go for, a few $100s for groceries and things like this. And so for that effort, we've actually been working in partnership with the Baltimore City Mayor's Office of Employment Development, the Baltimore City Bureau of Budget and Management Research, Central Scholarship, which is a local intermediary and CBO, and also the Baltimore City Mayor's Office of Immigrant Affairs. Here, our goal is to primarily target vulnerable worker populations, but primarily folks who've not been able to access federal or state relief, either because of their status as immigrants and undocumented workers, or even being non-custodial parents with things like outstanding child support arrearages. So we're actually looking at particularly vulnerable worker populations. We're partnering with the city of Baltimore to actually support the city in deploying about $6 million in public aid to local residents. Now, what's interesting about this partnership is that this is a case where we recognize that the infrastructure needed to get resources out to vulnerable communities and populations is where the private foundation community can actually come in to help. So how do we actually think together to make sure that that infrastructure actually exists? So
Right.
we've been working together to convene partners across different stakeholder groups. We've actually been resourcing, or will resource, the community-based network of folks that will do the work of identifying cash recipients. And then we're also partnering with our global colleagues as a part of a national campaign to actually learn from other cities along the way. So
That's great.
that's an example of one initiative that we've been working on. There are others in along the lines of direct services and supports, both through our Community Fellows program, as well as our Addiction and Health Equity program and Criminal and Juvenile Justice program. There, we're just looking to make sure that critical direct services are getting to vulnerable populations, such as those who are incarcerated or at high risk for incarceration, and also people who are using drugs in this time. And then we also have a few investments that are focused on the mid and long term, partnering with local consultants to actually check in to say, like, how's the landscape shaping? How's the economy shaping? And what do we need to prepare for in terms of philanthropic strategy to make sure that things like jobs, access to resources are not only made available in the short term, but also over time. Karen, I'll turn it over to you to pick up as well.
Sure. Take it away, Karen. So great you could join us today. I love having you both here in a tag team, so thank you. Oh. Can you unmute?
Can you hear me now?
There you go.
Thank you. Technical
Yeah.
difficulty. No, I'm so happy to be here. And Brooke, it's always a delight to partner with you, as we've done for years and years.
Yes.
Thank you for your leadership on this effort. Danielle, I'll just take up where you left off and begin to discuss another area that we looked at. One of the things that happened early on is that we began to meet as a team and say, what does the entire landscape look like, and where do we see our most vulnerabilities? And of course, as Danielle mentioned, people who were incarcerated, that was a public health issue, to have people stuck in a place where they really had no recourse and no way to self-isolate. But in my purview, I look a lot at education and what's happening on the educational front. And even though Baltimore City Schools did a great job of pivoting immediately, as soon as this crisis began, creating packets and mental health services, providing food to students, we knew that the majority of our kids are not connected to internet. So when online schooling began, there was only about a 15 to 20% participation. And that was not because they didn't want to participate. Folks had come to pick up packets, but it was because of the digital divide. 85% of our children are low income. And I don't know if you've looked at your Comcast bill lately, but mine continues to go up and is not affordable even to just midline people. So for people who do not have the means, it became an impossibility. And of course, we know as this is all happening, people are also getting rid of the things that they don't have to carry as people lose jobs and income. So our kids were disconnected from the very source of their education, which became internet. In addition to that, we saw that low-income communities were disconnected from public health services. So they didn't have the up-to-date information necessarily in terms of what was happening to COVID. That information was being passed by word of mouth. And then the third piece was the food drops. Where were the food locations? That was another thing that was happening by word of mouth. And you know, Delegate Learman posted a really poignant video showing there were a little gaggle of kids who showed up on their own to go get food at a place they heard had food, and by the time they got there, there was no food left, and someone came back and delivered food to them for their whole family. So these are the kinds of things that we're dealing with, and as we're quarantined and sequestered from the reality of poverty, it's hard to know exactly how much people are struggling unless you sort of make that effort to see what's really going on. So having said that, there are things that are being done to really address this issue, because more and more people are seeing that this is a problem on multiple levels. Schooling, yes. Public health, yes. Also employment. Even our children this summer who are going to work for YouthWorks will have to be connected to the internet somehow. One of the things happening in Baltimore City Schools is that they did have a huge push to buy Chrome netbooks. So children are being supplied with the instrumentality. But then again, the issue is, what are they connecting to? One of the things that I think, so some of the things that they're connecting to are traditional hotspots. There are deals being laid out between Baltimore City school system and Comcast networks that will provide more people with connectivity. Today there was an announcement by children. Somos is the name of the group, demanding that they have connectivity so that they can proceed with their education. But there's a very interesting process going on also called the Mesh Network. And we have invested in that network. So has ABLE, I think Deutsche Foundation, some other local funders have invested in it. And basically what it does is take the internet connectivity from the school system and direct it out into the community. And then the community surrounding the individual school buildings will be able to have internet access free of charge. And it's also really decent in terms of the speed and the capacity. So we've been working closely with the Baltimore Digital Equity Coalition, also with Zeke Cohen, Tina Hike-Hubbard. It's a very interesting public and private and foundation partnership. And again, as Danielle was saying, our funding we see can be used for the things that are not as accessible to the public sector. So the things that can fill the gaps and leverage our ability to move forward. One of the other things that has happened is because of the foundation push, or us being involved also, we were able to jointly leverage funding from the public sector. Zeke Cohen and Brandon Scott, Mayor Jack Young, donated $3 million to this effort to have students be connected and also have the materials they needed, the digital equipment, to make those connections stick. So those are some of the things that are happening. It really was about a landscape analysis, Brooke, and seeing where we were hurting the most, and then staying the course and trying to move it forward.
Yeah. I think that's important. And I think, you know, we had a, last week on our webinar, we had Andrew Coy and we talked about the digital divide. And, you know, I think the concept of the mesh network provides a really great illustration of how nonprofits and philanthropies complement government. And, you know, so here we have a nonprofit, the Digital Harbor Foundation, working, you know, with this idea to do a mesh network at schools, you know, that aren't being used when they're not using their internet. And for those who don't know what a mesh network is, it's like if you're in a house and your house is too big or there's brick walls everywhere, you can plug in something and then the internet service is better. It like sort of amplifies your internet through other locations. So the idea is to put one of these meshes on the schools while the schools aren't using their internet, and take that internet capacity so that it sort of radiates out and people can use their Wi-Fi to hook into it. So they had this idea at the Digital Harbor Foundation, and then of course they went to the foundation community. You know, they brought it to the school system. School system like, we'd be happy to try out. We don't have any money for that. So, you know, of course, some great philanthropies like OSI and ABLE and others, the Deutsche Foundation stepped up. And what's so important about that is that they're going to start at 4 schools. And because they were able to get the seed money to start it, they can prove the concept, right? And so then, right, like government, we are often reticent to put money towards something if we don't know it's going to work, right? These are taxpayer dollars. We feel as we should, you know, very concerned about making sure we're not, you know, being spendthrifts and, you know, just throwing things after ideas that we don't know if they'll work. So the idea that foundations can work with nonprofits to prove a concept and to show that it works, so that then government can come in afterwards if it does work and say, okay, you've convinced us, this is now a good investment. I mean, I just think that's such an important part and role of the nonprofit philanthropy relationship, and it's such a symbiotic one. It's great. I didn't get to introduce Karen, which meant that I didn't get to give a shout out to my law school alma mater, the University of Texas School of Law, where she also went to law school. hook 'em. But so great to have you, Karen. Thanks for joining us. And now I'm thrilled to have Celeste here as well. And, you know, the Maryland Philanthropy Network is doing such important work at connecting all of the, connecting funders to donors, or connecting funders to nonprofits, and talking to folks like me and Senator Kagan and Senator Carter and other elected officials about, you know, where we see gaps in the work that needs to be done. And so Celeste is president and CEO of the Maryland Philanthropy Network, and she joined the philanthropic community in 2012 after 18 years invested in public service issues and issues including housing, economic development, public works, and environmental initiatives. Thanks so much for being here, Celeste, and really excited to hear what you have to say. Thank you.
Thanks, Brooke, for including me today. I really appreciate it. And it's always great to be here with my colleagues who often make it unnecessary for me to really talk, because they do such a great job of sharing what we all do together, which actually makes me feel great, and I appreciate it. And especially Heather, who we sometimes function as two halves of a whole, and I really appreciate that partnership with her, because she knows the story of our organization as well as we know the story of hers, and it's a really fantastic partnership. And I can't really top or a whole lot more about what everyone has said about how we are trying to work. So I'll just share a little bit about our organization itself. We are about 130 members. We are a member-driven organization, and we represent about 130 private philanthropies, but also a mix of corporate foundations, intermediaries. Those are folks who don't have endowed funds but are passing through state or federal money to local organizations, as well as individual donor advised funds. So our members are primarily folks who have some sort of formal giving vehicle through which they do their grant making. And we're really organizers of that community. We coordinate, we influence grant making practice, and we strive to support collaboration. And as I think it was Danielle who alluded to how much we are coordinating and interacting with funders right now around the response to this pandemic. I would say that from the start, and I think it is still somewhat overwhelming, funders have felt compelled to keep their eyes and giving focused on basic human needs to some extent, the urgent needs and the emerging and worsening crisis kinds of needs. The disparities that were already there before that we're seeing only become worse as this pandemic continues. So one example is food access, which has been a conversation almost since day one. Almost every segment of our membership is focused on supporting food access in some way. And we are coordinating with the city and Baltimore County in particular around food access because of the concentrated need here, and really thinking about where the city and county are able to meet the need and where funders can uniquely fill in the gaps. So there has been a lot of conversation. Food is just one example of where philanthropy can play a role. As you've all beautifully walked through earlier, in the gaps, the places where government funding and other sources just can't meet the needs in the same way, aren't as flexible. The digital divide is another conversation that has become an intense focus for our membership that affects virtually every issue that our members organize around. So that has become another intense conversation, and Karen shared a lot about how those conversations are going and where funders are looking to support innovation and coalition approaches to how you solve this problem with government as a partner, and sort of proving those concepts and bringing them back to figure out how we can scale them up together as partners. And I would just remind everyone that we too are also statewide, though a lot of our conversations and even what we talk about today will often sound very city-centric, but the issues that we're experiencing here in Baltimore are not unique. They are the same in communities across the state. And I just want to remind us all of that there are valuable lessons to learn here and how we tackle the scale of our challenges here to tackle them well in other places around the state and in our communities.
Absolutely. Thank you for that. That's great. Well, there were a number of questions that were submitted beforehand, and I think you've answered some of them, but we're going to go through a couple of them because we have a number of people on the call who asked those questions. And then if you have questions and you're on the call, please feel free to put them in the chat box and we will get to them. So there were some questions about local and regional foundations. So Celeste, Danielle, not sure who this is for, but feel free, one of you, to answer, and anybody can jump in on any of these, of course. Are local and regional foundations siloed rather than collaborative in their efforts to make a difference in Baltimore City and the surrounding area? Do they meet to discuss how to have a greater impact? Do they talk with the mayor and other people at City Hall to try to strategize? I see Celeste.
Yeah, I should probably take that one, Brooke, because that's exactly why our organization exists.
Right.
We were, it's been just over 36 years ago, by foundations for exactly that reason. They realized that they weren't talking to each other about what they were being asked to do and how they were being strategic about doing it. So the answer is yes, and we are actually that coordinating force on behalf of our member foundations. There's certainly many, many foundations in Baltimore and across the state. Many of those are not necessarily active foundations, but the active and probably largest, most of the largest foundations in the Baltimore area are members of our organization. Yes, they do organize themselves in issue areas, but part of our job as a coordinating force is to break down those silos and make sure that we connect members across issues and to focus on intersecting issues. The digital divide is a great example of issues that cross, of an issue that is crossing every other issue area and it has to get the attention of funders no matter how they focus their grant. And yes, we do meet with the city and Baltimore County in particular because of where we sit and again the size of population and some of the challenges we face and how we're seeing those challenges escalate during this time. We currently convene with representatives from the county executive's office and the mayor's office every Friday with a funder community briefing call and talk about some of the gaps that they're experiencing, get updates in general. So and there's a lot of individual conversation.
That's great, thank you. There were also several questions about, recognizing the need that exists right now. Our foundations, or what is a conversation around long-term strategy, long-term strategic thinking, and profits who are, they're doing food access right now, but they also have to keep thinking about, 2 years from now in their neighborhood and making sure they're still adhering to the vision plan that they created. And, this is that they're trying to address immediate needs, but they also have to keep planning for the future. I don't know, I'm sure Heather, you have lots of nonprofits that are seeing that. I don't know if any of you have thoughts on responding to how is the foundation community dealing with that? Are they keeping that in mind? Or, is it sort of just we need to focus where we are right now, or, different foundations doing different things? Take it away.
Yeah, go ahead, Karen.
Sorry, I was just going to say that one of the things we do, Brooke, at OSI Baltimore is we kind of go in for the long term. Most of what we do is not immediate response related. So we narrow the focus of what we do so that we can stay in till completion. I'll just throw an example out there, restorative practices. We've been involved with restorative practices for the last 5 years. And as students re-enter school, whenever that happens, we're going to be right there in the forefront, making sure that sort of the trauma that people have experienced, both teachers and the students, will be handled in such a way that there are many discussions and that kids are not just walking right back into algebra after this pandemic is quelled. Right. So this is how we do our work. We don't do one-timers. We generally support the same efforts over a long stretch of time until we can see it really institutionalized.
Thank you. Other folks.
So I think it's a great question, and what this crisis has done is really put an X-ray on all of our public systems, and we in the nonprofit sector have been talking about the need for systems change for a long time, and it might be that this crisis will allow an opening for that conversation in Maryland and nationally. But if we look at our education system, our justice system, our child welfare system, our health system, our transportation system, our housing system, all of these systems have been failing for years to truly meet the needs of communities. And this crisis has just laid that bare and what we're seeing, not only the crisis in this state where Hispanic people now have the highest rate of infection of any race in the state, despite only being 10% of the population, and African Americans having the most cases of any race and the most deaths. So these issues of inequitable systems have been deadly for Marylanders in communities. And so the long-term conversation really must be, how do we truly reimagine systems? And it doesn't necessarily mean that it's going to cost a huge amount more. In the short term, if we can build things to be better suited for what communities need, they can actually save money in the long term in terms of high costs of incarceration and other things. And when we look at how other countries have responded to the crisis, not only the health crisis more effectively than this country has because of our diffuse health system that has proved to not be much of a system, they've also responded better economically. So they have, where our government had to create from scratch this paycheck protection program that was very complex. We helped hundreds of organizations take part in that program. We have a webinar tomorrow at 10 a.m. on how to navigate the forgiveness for it. We've already had to make decisions over this 8-week period, financial decisions that we don't even know what the rules are yet.
Right.
So in other countries, they've had already existing mechanisms for government to be able to take over companies' payrolls, for social safety nets to kick into gear. So they just needed to amp up those systems rather than create things from scratch. So the long-term thinking is really about systems change and us as a system too, as a philanthropic system and as a nonprofit system. We're just as plagued by inequity as all the other systems in the country. And so we can do better as well.
I just would like to add that along the lines, just to echo Karen and Heather's comments, so in the short term, what this means is that we have to support organizations that are doing the work of immediate advocacy and kind of community engagement and kind of lifting up immediate issues, but also organizations and leaders that actually have the ability to help us to pivot. And so we do have a few investments that we've made in organizations that bring a set of capacities around policy advocacy, structural reform, and also bring that lens. So that's one, kind of side of it. I also want to lift up the importance of analysis. And so, and this is where OSI will be partnered with other foundations that are just interested in checking in with each other to say, how is this moment actually shifting or shaping how you're thinking about your approach to investing in the short term, midterm, long term, as best we can even envision it, recognizing how difficult that is. The ability to actually do quality analysis requires capacity and time, and a lot of time that very few folks actually have at this moment. And so one way that we thought that we could actually help as OSI is by supporting a consultant, Marsha Kingslow, who will be helping to conduct interviews with public, private, community stakeholders, just to ask these questions around where do you actually think things are headed, and where does philanthropy and the role of other local stakeholders actually fit in. Our hope is that we can impart this information to others locally so that we can have more of a collective conversation around what we're all kind of thinking about in terms of our immediate roles, but also how these roles will shift over time as well. So I just wanted to lift that up in the way of other activities that are underway.
I appreciate that. That makes sense. There were a couple questions that were sent in, and then John also had a question about the role of advocacy. So what is the role of, will philanthropies, who I think in the past, sometimes they're not as eager to fund advocacy, but of course, having a systemic change like improving SNAP benefits so they can be online will end up affecting many more people than simply, than funding perhaps a food bank so people don't have to line up at a food bank. We need them both, right? But I'm curious, and there were several questions about the role of philanthropies in rethinking their response to this in terms of and funding advocacy efforts. As we look, certainly our revenues are declining. And our government is going to be, the Board of Public Works will be slashing budgets. And next year in the administrative, during the General Assembly session, we'll have a very tough budget season. What is the role of the nonprofit sector and philanthropies in making sure that we are funding the things that are going to go to the most under-resourced neighborhoods, so that we can make sure we're keeping, that in mind? Any thoughts on that?
I can jump in there and just say, and with Danielle, say that OSI Baltimore has funded advocacy forever, for as long as we've been around. And it has sometimes been seen as a controversial approach to philanthropy, but we've also found it to be most useful. For example, one of the last things that we funded that was successful and then it was vetoed and then hopefully it'll be overridden is the Kerwin strategy and work around providing adequate funding for schools, and which would obviously affect Baltimore City and other school systems that are under-resourced. But we went full tilt. When we were approached, we immediately said, this is a thing that we have to do. This could be a game changer. And we found ways to support the advocates who were on the front line and to even build out advocates who were not originally in the pool. So this is a strategy that we use constantly. We've had great success with it. Sometimes there are failures, but we don't go into it thinking if this doesn't succeed, I'll never fund advocacy again. Because we know policy change has to be one of the tools we use to changing the way society interacts, especially with people who are marginalized.
Yep.
Thank you. And I'll also pop in here. So advocacy is a big part of Maryland Nonprofits mission. And during the legislative session, we have a weekly policy call, and we have about 50 different nonprofit advocate leaders from many fields across the state that try to coordinate advocacy work so that we're not fighting over the same dollar, but really raising the bar for all nonprofit organization missions and resources that are needed. I think it's important also for people who are interested in progressive social change to note that there have been some studies that show that the foundations that are more on the conservative side fund advocacy at a far higher level. Advocacy and think tanks are much more funded by conservative foundations, and more liberal foundations tend to fund more direct services. So they're dealing with the impact of inequitable systems and not necessarily investing enough in the kinds of advocacy and think tanks that are needed. If you look at the organizations in Maryland that advocacy is their primary mission, they're some of the smallest organizations in the state. So there's really not a lot of funding going into advocacy, and it's definitely something that funders can do in the form of general operating support, and is really needed, because just putting into perspective, the Paycheck Protection Program brought in about $1 billion into Maryland's nonprofit sector. You know, there's no grant making collaborative in the state that can even fill a thimbleful of what the federal government was able to do. We were part of a national network that was really a David and Goliath effort. We were tiny. To get nonprofits into the CARES Act in the first place was not easy. And, you know, making change like that at the federal and state level is highly impactful and very important. Thank you.
Yeah.
Brooke, can I say one other thing? Just that,
oh, of course, yeah.
Some of the changes that are happening as a result of COVID are things that we have our eye on so that they would continue. So for example, we found in the addiction space, folks are being given more and more methadone to take home with them, as opposed to having to run back and forth every day to receive their methadone treatment, thereby forsaking their jobs, their children, and those types of things. If that can happen during COVID, then that should be able to happen during normal times, whatever normal will be. Similarly, people are being let go who were being held on bail for nonviolent crimes. Why are we over incarcerating people in the first place? And this only gives evidence to the fact that we need to include this as a permanent solution, not just a COVID solution. Similarly, of course, again, the digital divide issue, I never thought of the school building as a safety net, but it is a safety net. So when it was removed, when libraries were removed, my goodness, when McDonald's was removed, kids who had lovely phones suddenly didn't have anything that they could do with them. So I think it's the exposure, but it's also the things that have been exposed that are being treated differently. We've got to keep our eye on them and make sure that they're sustained after COVID.
Mhm. Thank you. I think that's a great point. There are a lot of changes that hopefully we are making now that we should have made before, and that the urgency of this situation are forcing us into, that we can continue. On the methadone thing, I was reading recently that New York is now actually doing delivery too, which I find, interesting and potentially helpful, especially in some neighborhoods that are oversaturated. So there was a very specific question from somebody about can or will the minimum payout for foundations be increased from the current 5%? Are any foundations looking at increasing their payout from their endowments? Is that, and why or why not, I guess, is one.
Oops. I think I froze up there.
Yep,
I could probably
go ahead.
take that one. Some of our foundations already are giving more than 5% on an annual basis, even before this crisis. Certainly they can choose to give more, and many are considering what they will give. None of our members have talked to me about decreasing or responding to a recession by decreasing their giving. And to Karen's point earlier, many foundations give in their issue area and have been longtime investors in the organizations that they're giving to, and they're not planning to change those investments. They're striving to keep them the same while really looking deeper at what more they can give now in response to the emergency, so it isn't necessarily cutting what they would have typically been giving to in the first place. So I would say yes, and of course there could always be a legislative change that mandates a higher percentage as well, but most foundations are thinking about that already, and we're certainly encouraging that conversation and trying to understand what our collective membership is thinking about. We actually have a survey out right now asking about that.
That's interesting. There was another question that I thought was interesting that also has to go with structural support for nonprofits, which is that while many nonprofits still need to do their work in person, where do you see grant making's role in supporting upgrades in IT and building internal capacity to do work remotely if need be for an extended time in the future? I mean, this is sort of like the digital divide discussion that we've had with schools, right? If you were a small nonprofit, it could be that you have not updated your operating system in many years. And now, and you could get away with that when you saw each other in person, but now that you're remote, it's, slowing your ability to do work down. And I know, I work with so many of the great nonprofits in my district and around the state, of course, and it's always a concern. How do we get operating funding, right? So I'm curious of thoughts or, ideas on supporting sort of the structural changes within some of the nonprofits, or Heather, what nonprofits are asking for.
I will say that there are some foundations that will only fund capital, and sometimes technology can be considered capital. So that is one area that people may want to look to. And we spent a few years upgrading our financial infrastructure, and it was not easy. And I was just like, oh, thank goodness we did that before this crisis. But really transferring your financial management to the cloud, transferring, using Office 365, all of those things are important. And I hope that foundations will support the infrastructure nonprofits need to innovate in this time. And I will also say not everything is bad that's happening these days in COVID. And we at Maryland Nonprofits have served 4,500 people since March 11th. And we've served maybe 2,500 people in the entire prior year. So our productivity has increased. The population we serve is largely online though. So we don't have the digital divide issues as much as people serving communities.
Thanks for that.
And the other thing I will say, telehealth, and in the foster care community, they were never allowed to do any visits or they were never paid for visits by phone or internet. And the families are really appreciating that support. It can be more frequent, it can be more tailored, it can be more individualized to the child. So there's some innovations happening that, again, to Karen's earlier point, that we should keep.
Yeah, that's great. I'm going to unmute
Brooke,
Senator Carter. Oh, sorry, go ahead. Go ahead.
I was just going to say Senator Carter, I think, is trying to get in, and that's what
Yep,
you
I was just unmuting her so that she could ask her question. Senator Carter, I just unmuted you if you want to ask.
Thank you so much. I'm sorry I got stuck in private mode and I couldn't seem to get out.
No worries.
I appreciate you doing this, first of all, Brooke, and everybody that's participating. I'm learning a lot just listening. I wanted to find out about any consideration that's been given to emergency assistance with respect to what I anticipate to be an avalanche of evictions once the courts reopen. We know there's been a long time need for legal representation for tenants in evictions, and Baltimore City had already, before COVID-19, had a lot. And with all of these evictions being put on hold, it's my understanding there's nothing that's been done to work them out, mitigate it, or settle them. And I'm concerned that all of these cases that have been on hold will just immediately be brought in, and tenants won't have any assistance or adequate assistance, because I know there's organizations out there that are already helping them, like Public Justice Center, Legal Aid, and others, but they are under-resourced already. Thank you.
Yes, I will say that the Community Development Network has really been taking the lead on this issue, and also coordinating with other organizations like the Homeless Persons Representation Project and Healthcare for the Homeless and others that are really bracing for a housing crisis once the eviction relief is lifted. And that's really going to be something that is going to require a public-private partnership. I think there's really no way that Philanthropy can pick up the massive costs of subsidizing people's rent, but Philanthropy can help with the legal issues. And you mentioned some of the organizations. I think you mentioned Legal Aid. There's also the Pro Bono Resource Center as well, that provides legal aid for tenants.
Yeah, the other hope is that an organization like the Public Justice Center to be able to pivot back to having like a tenant advocacy program, which was very, very effective. So I think that we'll be seeing some innovation coming through. And just to add that OSI has supported the Public Justice Center over and over again. And I used to work there, by the way, just as a.
That's great. Thank you. So there's a final question we'll take in the chat, and then we'll let you all, if you have any final comments, share them. Are you informing donors about care impact for individuals being able to donate more as tax impact of limits on itemized and expansion for standard has been increased in this RISS? Ellen, I don't know if I totally follow your question.
I think I got it. Yeah. So, and thank you for the reminder, because we do need to get the word out more that there's now an above the line tax deduction of $300 that donors can take for their gifts to charity this year. And that is whether or not you're itemizing. So that's what they mean by above the line. So, there are 260,000 Marylanders that stopped itemizing after the Tax Reform Act 2 years ago, which we would have just been doing surveys of our members right around when COVID hit to see what the impact of that individual giving change has been. But that's been another hit to charities, that individual giving has not been incentivized like it has been in the past through the tax code. So the CARES Act can help a little bit.
That's great. Yes. And if if Maryland nonprofits or foundations or anybody is putting out information on social media about that, certainly make sure you're sending it to the General Assembly members. I'm sure we'd love to post it and make sure that folks know that if they have the ability to donate to the nonprofits in our districts and around the state, that they will be able to do this. So that's great. Thank you. Any final comments? I want to be respectful of everybody's time, but any final comments from folks? Celeste or Danielle or anyone?
I'll just say I really appreciate this conversation and hope that it continues. Brooke, thank you for bringing us in. And
Yes.
because unfortunately, as we all know, this is likely only the beginning of, we're dealing currently with the public health crisis. But when we think about kind of the economic fallout of everything, there's a lot of work to do. And so at OSI, we really hope and look forward to continuing these types of collaborative discussions about strategy, where we all fit into the bigger picture so that we really can leverage the best of our resources, monetary, non-monetary, and really think about how to complement what everybody else is able to kind of bring to bear. So thank you again for including us, and we just look forward to this discussion continuing.
Thank you. I'm gonna put up our information too. Yep, go ahead, sorry. Did I cut someone off? Sorry. Okay. Well, I just want to say thank you to everybody for joining today. This has been a really interesting and enlightening conversation for me. And, I always like to end these on a note of gratitude, right? We are all in our safe spaces, often at home these days. And that is only possible because there are so many people out on the front lines working, whether farm workers, our healthcare workers, folks working in grocery stores, our transit drivers. So really a note of gratitude to all of them for the work that they're doing to keep everything going. I also wanted to invite everybody on to join us this Thursday at 2 p.m. I will be doing a briefing with Anne Arundel County Executive Stuart Pittman on housing and support for renters and how housing all Marylanders. We'll also have members of from the Public Justice Center on, and Barbara Samuels and others. We'll also have some affordable housing advocates. So I'm looking forward to that discussion as well. But thank you all so much for joining us today. Thank you for the work that you're doing. And I look forward to keeping in touch. So everybody stay safe, stay healthy, and keep in touch. Thank you.
Thank you so much, Brooke. This is terrific.
Thank you.
This was great.
Thanks.
Mhm.